we will get information, any new information from our panelists, but we also invite those listening on the webinar to provide us with their own updates from the country level. If you have an update to provide, it would be great if you could send us a message through the chat or through email to Liz Colway so that we can know to call on you and be able to hear what you have to provide us with. We will then follow this with any other updates, and we will have time for question and answer. Again, as we've done in past webinars for the Q&A, we will ask you to send your questions through the chat box, and we will read them back to everyone before having them answered by our panelists. So once again, welcome, and we will get started. So Joanne and Mesfin, over to you for your input from the recent investors group meeting. Thank you.
Thank you, Christine. Hello, everyone. This is Mesfin Teklu. As Christine introduced, I am one of the civil society representative in the investors group. Joanne and I will are speaking today to give you a briefing from the investor group meeting that was held on 17th and 18th of February 2016 in UK, outside London. I'll go through a few points on the issue that was discussed in some of the agreement, and then Joanne will complement on the key issues around financing and civil society engagement. So the investors group meeting, it was held in 2 days. It was in a retreat style with many of the investor group members participating. We had the global partners as well, but from the countries we only had Kenya who participated in person. We are also joined by Cameroon by video from Cameroon, and also the High Commissioner for Cameroon joined the meeting in person. But Diane Jacovella, who is the chair of the investor group, spoke to each of the country representatives by phone, and also, their feedback was taken into account during the discussion. So we covered a number of areas. I think we shared many of the papers that was prepared for the investors meeting, which includes a paper on financing and the proposed approach to facilitate countries, the private sector engagement, and of course framework for resource mobilization, and the GFF in fragile context and humanitarian settings. And of course the other paper was on the technical guidance, quality assurance, and country platform paper. I think you have seen some of this paper ahead of the call. So the IAG, the investors group, were asked to review and provide guidance to the task teams that have been asked to develop this paper. So we had very rich discussion on each of these issues, and if I may start from the financing RMNCAH, I think from the Secretariat, Dr. Christoph presented, the trend in RMNCAH financing, and discussed about the health financing transition, both looking at domestic financing as well as development assistance for health. I think the investor group has considered the option that was proposed, looking at health financing within the context of a health financing strategy. I think the general suggestion was that this agenda item of financing, the investor group need to put it in their regular deliberation, how to mobilize additional resource for health. including domestic resource and issues around revenue collection through taxation, and how do you gain, efficiency and market shaping, and some of the proposals put forward in the private sector paper. So that will continue to be updated. I think there are quite a number of issues that were highlighted and asked for further analysis. So this is a standing item for the IG meeting. And we also had updates from Cameroon. I think through, as I said, through video link from Cameroon. So they kind of explained the GFF process they have gone through. I think Cameroon is a good example in terms of the process being inclusiveness. I think at one point they mentioned around, they had even civil society, around 200 civil society organizations that participated. I think there is a kind of, one need to strike a balance in terms of inclusiveness as well as having meaningful discussion. So I think the implication for the civil society is that in the country civil society group, I think there need to be proper representation. It's not realistic to expect everyone to participate, but at the same time to have people who represent the civil society to be selected and represent in the country platform. And the experience from Cameroon highlight that actually we need to do better in terms of that level of coordination and engagement. The other point, we had also the facility countries paper that was again worked by the facility team. How do you reach out the remaining 51 countries that are not necessarily currently receiving GFF assistance? As you know, the GFF so far has been implemented in the 12 countries, including the 4 front runner and the 8 second wave countries. But there is kind of a general feeling that we need to make sure that the other 51 countries don't feel like that they are left out or they are not getting attention. So I think the general recommendation was, I think 2 recommendations were put forward by the task team. One recommendation that was adopted by the investor group was to adopt a phased approach for reaching out to the 51 countries. So it is important, again, to communicate to those remaining 51 countries about, the GFF, and even though there may not be, trust fund available for them to be able to start, investment case, but I think there are quite useful resource that has been developed for the 12 countries that will be useful for the 51 countries as they are developing their investment plan. So the agreement was for the GFF investor group chair to the remaining 51 countries, basically outlining the GFF process and ensuring that they continue to engage, but at the same time without necessarily raising expectation, because I think with the current finance available through the trust fund might not be enough to reach all the 51 countries. So there need to be a phased approach for reaching out the remaining 51 countries. So that is the approach that's being proposed, and there is a plan for the IG chair to write that message or letter to the 51 countries that will go out from April, I believe. So we also covered the country platform paper and the quality assurance and the technical assistance. I think this is where we spend a lot, and this is where the minimum standard that civil societies recommended for GFF have been discussed. And Joanne and I had an opportunity to share the comment or the feedback that was collected as we were developing the minimum standard even just sharing the content of the minimum standard around inclusiveness, participation, accountability, and stakeholder engagement. So there is, positive reception by the investors group for the minimum standard, and there is a recommendation that as a Secretariat is developing the general guidance for the country platform. So there is a country guidance document that's being developed, and it was recommended that the minimum standard that was proposed by the civil society should be incorporated in the country guidance document. So we, Joanne and I will be working with the Secretariat to ensure that the provisions or the recommendation from the minimum standard will find their place within the country document. So that is a progress, I think, from the last meeting, and I think we are pleased, with the inclusion of that. But again, the real thing happens at the country level. We all have to be able to see how that minimum standard is being applied at the country level in terms of when they are implementing the country platform. So that is one thing. I'll let Joanne also comment on that. I think that's quite a rich discussion that we had, and we are pleased with the outcome. And just I will talk on the one of the paper, and then I will pass on to Joanne to talk about the private sector and the remaining recommendations. On the fragile state and humanitarian situation, again, the task team presented their recommendation to the investors group how the GFF should operate in fragile context and humanitarian settings. And the investors group, welcome the recommendation put forward by the task team, but they also acknowledge that the GFF mechanism may not be appropriate for responding to humanitarian emergencies. I think, they recommended that we should actually learn from what's going already in fragile contexts, which are already part of the 12 countries. As you know, DRC and Liberia and the others even are considered as, one of the fragile countries. So what are you learning from even the existing fragile countries? And we need to document that, share that experience, how we are, the RMNCAH agenda are addressing within the current or the priority 12 countries. So it was recommended that the task team to document the experience within the 12 countries and further develop the guidance how the GFF could support countries who are considered as fragile or having humanitarian emergencies. But there was a clear recommendation that the GFF mechanism may not be necessarily appropriate for responding to emergencies, rather ensure that actually health systems are prepared and being resilient to be able to respond to humanitarian context. So that is perhaps maybe the key recommendation that was put forward, and it was a very rich and quite diverse discussion, and quite a number of recommendations put forward for the task team to further work and present those recommendations to the next IG meeting, which is going to be in June this year. So there is more work that needs to be done. So I will ask maybe Joanne to talk about on the financing, perhaps the strategy on communication, and a bit more comment on the country platform paper that probably we specifically make a specific request, and then that is something that we'll be following up. Over to you, Joanne.
Thanks, Mesfin. And so I think you did a great job of outlining. So I'll just make a couple of additional comments on a few of the areas you touched on, and then talk a little bit about the private sector discussion, and then I think also resource mobilization discussion are both important ones. So yeah, as you said, on the minimum standards, we did have the opportunity to present that, including sort of the findings what what had been the experience to date from civil society and other partners, and again emphasizing that this is really not just about civil society, but it's really about the sort of how do we support the strongest multi-stakeholder platform. And then I would, and we will look forward to sort of seeing this in the country guidance, and we'll have an opportunity to engage in that and give some input. And then, the only other thing I would say that's emerged a lot from the discussion, so this wasn't, we discussed it a little bit in the meeting, but I think it's also important for all of us, was, is just the kind of really smart work that's already been happening at the global level, the regional level, the country level, to support countries to make use of this kind of guidance. So in the end, in many ways, civil society and other partners also using this guidance to sort of drive best practice will be really key. Even when this comes out as guidance, it'll be really important for us kind of individually and collectively to kind of continue to figure out how to highlight this and make use of it as a tool for civil society and other engagement. I guess the other thing I would just say around the approach, this sort of discussion on approach to facility countries, which you described well, there was this, again, this real discussion of, given that there are 63 countries considered potentially eligible, and then there's 12 countries in this sort of first and second wave, just I think a smart discussion again about how to engage and provide support or resources or tools to the larger set of countries. Again, worth noting that that core set of 12 countries is the majority of burden, both of illness and also mortality related to RMNCAH in terms of needs. But still, how do we address the other countries? I think there were two, I think, smart concerns about not going too fast and trying to expand to all countries. One was not creating expectations on the part of countries, given that there is a constraint in terms of the resources available through the actual fund for the Global Financing Facility. And second, in some ways, that we want to continue to strengthen the process and the mechanism so that we really have the sort of strongest possible best practices, examples, before trying to replicate this to 50 plus more countries. And then third, we'll come back to it, is the need for really for the resource mobilization strategy, so that we actually have more resources that could be available to more countries for this. But again, in the interim, what would be available is kind of some of the lessons learned from the first set of countries and the country guidance. And I think interest, frankly, on the part of some partners in country to potentially look at how they could support some additional countries to be engaged in this and engaged in creating the, in creating investment cases. But I think that's to be determined on a kind of country-by-country basis. The other areas I would just comment on. So there was a draft paper presented on a private sector engagement strategy that had been put together by a task team. And that basically focused on three areas through which the GFF could engage with the private sector. One is supporting innovative financing mechanisms, things like development impact bonds, IBRD, so kind of commercial rate loans, buy downs to more of a concessional rate like you would get with IDA, based on performance and engagement with private sector as a tool for financing some of that potentially, and then also looking at ways to engage partnerships with the global private sector and engaging the private sector, leveraging it at country level. So based on our own review of this, but also input from a number of partners, we raised several issues. One was around the issue of equity as a priority, that even though equity as a principle and as a priority appears throughout the business plan and throughout the GFF documents and strategy, that it seemed like it was really important to be very explicit about that here. I had just raised the issue of, some of the experiences already with the IFC's investments in health in Africa based on both the sort of midterm evaluation of that, but also analysis and work that Oxfam's done to review that, where you really did not see a focus on equity or even on development impact in strong ways, and so the importance of really ensuring that as a priority in going forward on these things. And also we have in our role kind of repeatedly raised the issue of, yes, we want to increase the pool of resources available for countries, but make sure that we're not creating added debt burdens for countries, particularly in sort of non-concessional kinds of loans. So just sort of keeping that in mind. And as a sort of coming out of that discussion, what was sort of highlighted was the importance of equity, the emphasis on social impact within this, and that this should be addressed explicitly in the paper. So there would be work to be done to kind of go back into the paper and include this further. And then there was some further discussion around the GFF's role in issues like market shaping as it relates to the broader issues, and but also in part the private sector. Let me see other. We had a good conversation around resource mobilization, and frankly, part of it was a bit of just acknowledging broadly here on the table that we need, we want to see additionality of resources. We need to see resource mobilization, significantly increased resource mobilization in this space more broadly, as well as for the GFF, trust fund itself, but kind of in the broader space. And we need to be working on that with a potential looking to, particularly next year, as a moment to potentially also replenish this trust fund. But the kind of urgent need for ongoing and frankly more aggressive resource mobilization in the space of RMNCAH and nutrition. There was discussion about the importance of the global fund replenishment and the IDA replenishment in terms of, again, if IDA is leveraged, how that can be important for expanding the pool of resources for RMNCAH, and certainly also the importance of the replenishment of the global fund, which will take place later this year, and making the most of the sort of synergies between the global fund investments and other investments in RMNCAH. There was also discussion about a need for, looking deeper into where domestic resources come from, how to, looking at extractive resources and how they can be channeled to social sectors, tax revenues, market shaping initiatives, and then also sort of a piece around how do we capture the how do we ensure that the GFF is as effective and high impact as it can be, in some sense, to make an investment case for investment, in this process in countries, and how do we capture that information around so that we can make the case for further investment in this going forward, so that we actually have an expanded pool of resources. And then I think there's also the issue of how do we capture the demand at country level? Like, how do we actually show that we don't want it? We also want to be cautious, in how we look at these things, that we don't end up kind of, capping countries' ambition and expectations, but how do we actually capture, while supporting countries to do really important prioritization in their investment cases and national strategies, that we don't actually end up capping demand, but that we actually have the ability to capture the demand that countries have, even above their current resource allocation, because that's a way that we're also going to be able to, and we're going to need that to be able to collectively make the case for additional resources and support countries to do that. So I think I'm gonna, Mesfin, I don't think you mentioned it, but there was a draft code of ethics that was put forward and that was adopted. And we did have a bit of a discussion, just a smart discussion about how do we deal with information going into these meetings, and agreed that draft documents, that if there are documents that are fundamentally confidential, we would be made aware of that and be cautious with those. But in general, that we can have a process whereby we are able to get to use documents even in their draft form to get feedback from a core of folks who have been agreed to be engaged in part of this process, for example, in civil society. And I think that there's smart lessons learned from other processes as well, from my own experience with working in global fund board meetings and being able to sort of understand sometimes the draft nature of documents going into board meetings, but also being able to share those in a smart and appropriate way to get civil society feedback, so we're going into those meetings with input from a broader group of folks. So I think we had a smart discussion on that, which I think helped clarify some of those issues. Mesfin, anything else I'm missing that we should flag?
I think you've covered well. I don't know, maybe Diane is in the call, so if there is anything that's...
yeah, that would be great. If there's anything we've missed or that you would want to add, that would be great. She may be on mute.
Hi, we're just getting Diane unmuted so that she can chime in. While Liz is getting Diane off of mute, I just wanted to chime in about a couple of questions, in response to a couple of questions that we've already received, which are really about resources for GFF. One question was about where documentation is available, and I just wanted to inform and remind everyone that there is now a GFF website. So it's globalfinancingfacility.org. And that has a number of the documents available on it. At the same time, the PMNCH website and the Global Health Council website both also have documents and information related to the GFF available on both of those websites. So if you are looking for information, I'd encourage you to go there. One thing that is not yet up on the GFF website itself is any of the country level action investment cases, and so that is something that is still pending. So I think, are we okay with Diane now?
Diane, are you on the line? It looks like you might be muted still.
Okay, it looks like we've got Diane still unable to connect in, so we will work on that. In the meantime, let me go to Kadi Toure and Mati Ja, who are both on the line, and see if they have anything that they want to contribute to what we've just heard. They are both from PMNCH. And Mati and Kadi, if you also wanted to contribute anything about the country updates, it would be great to hear from you now while we try to get Diane connected.
Hi, can you hear me, Christine?
Yes, we can hear you, Kadi.
Okay, perfect. Hi, this is Kadi. I hope Mati's on the line and is able to complement. I think since the last call, we were able to update on civil society discussions both in Senegal and in Cameroon around trying to strengthen engagement in the GFF processes. Those discussions were very effective, both in trying to secure positions of civil society organizations within the national processes. I think both Senegal and Cameroon were able to request an additional 6 seats within the RMNCAH platform and mechanisms for systematic engagement, and so implementation follows for those two processes. But those discussions were also very useful in helping to identify key areas among civil societies where they needed to get better organized. For instance, in Cameroon, the call for the setup of an RMNCAH or SRMNCAH platform to civil society that would allow for constant consultation and discussion among those. Work is ongoing under the leadership of a range of partners, the Africa Health Budget Network, PAI, Chesserad. I don't know if any of those partners are on the call and may wish to comment, to sort of develop a set of guidance notes for civil society organizations that would, one, provide them with the adequate level of knowledge around the global financing facility, because from current outreach we understand that there's still limited knowledge about the process. Around the minimum standards as well, to explain and sort of rationalize the different principles that are included within those, and then around the processes for strengthening civil society engagement. And I think once those resources are available, they'll be shared broadly to help shape discussions in countries. But this really relates to the point that Joanne and Mesfin raised around the minimum standards now being sort of integrated in country guidance notes, but that not being the final, I think, objective, with the objective being that you have civil society organizations in countries that actually promote the use and understanding of those guidance notes. And from the experience in countries, that's what we're hearing. I think part of what we're interested in hearing today from all the different partners is, are there any efforts in countries that we might not be aware of that we can sort of build on or contribute to? So that really is where we stand and where we're quite interested to hear back from partners. I think another thing that we are doing is trying to facilitate access to information around the GFF, and Christine mentioned the World Bank website to try to ensure that information is available. But what we're also hearing from partners in countries is that there needs to be a more proactive way of disseminating information that isn't sort of websites. And so if partners on the call have any thoughts about mechanisms that ensure that people actually use the information, then we'd be keen to hear about that as well. Christine, that's it for me. I had a couple of questions for Mesfin and Joanne, but I can wait till the question and answer session for that.
Thank you, Kadi, and we will get back to you and give you a chance to speak again in a little bit. And Kadi, I want to laugh when I say this, but can I just remind everyone to speak slowly so that we can hear you clearly while you're speaking. I think that we've got Diane back on the line. So Diane, can you say something? We'll see if we can hear you now.
Okay, can you hear me now?
We can hear you. Wonderful. Success. Please go ahead.
Oh, okay. Fantastic. Sorry, I've been talking to myself for a long time. Thanks, everybody, and thanks to Mesfin and Joanne. Fantastic summary. I think you covered everything. I think there's one piece that Kadi and others have referred to, which is the communication strategy. So I might just hold that for when it comes up as an agenda item, but I think there was an extensive discussion on communications, and I'll speak to that when we get to that agenda item. But other than that, I think that was definitely the main pieces of the discussion, and I think there are several of those pieces which are going to be picked up in the next two meetings, one in June and one in November. So a lot of that work is kind of ongoing and will be revisited at various points during this year. Thanks.
Great, thank you, Diane. Let me just remind everyone, if you have questions or comments for the speakers, please send them in through the chat function and we can share them along. I think that we have heard in the past questions about the minimum standards and how those will be applied. There are, I think, frequently questions around how civil society can engage with GFF at the country level. So I'm just throwing those out to spark people to send in their own questions. Diane, maybe I can go back to you and ask you to address this question of the communication strategy right now before we go on to other discussions and while we're waiting for additional questions. Thank you.
Sure. So am I...
Yes, we can hear you.
Being heard now?
Yes, we can hear you.
Okay, great. So a few things about the investors group. Communication strategy, as it was discussed at the investors group, was very much prompted by the fact that there was a feeling that there wasn't enough communication, and that many of even the inner group of stakeholders were feeling like they didn't get a steady stream of information and so on. So we had hired a consultant to speak to everybody, and I think she did more than 30 interviews to try and see what the communications needs were and how we could better address them. And so that was a very spirited discussion at the meeting, primarily because of the reasons that Joanne and Mesfin have just described around how we communicate with countries that are not in the first and second wave, and how we manage the expectations there, and at the same time how we roll out the global public goods that the GFF is intended to produce, so that those countries can also benefit from some of that work. So that was a specific set of communication challenges around country level discussions, and also how partners receive information at the country level and so on, as well as how we communicate with those governments. And as has been explained already, I think it's decided that there will be a communication from the chair that will clarify the rules of the game, if you like, and that will be followed up with a sort of, as much as we can, a more transparent approach to communications. I think what has been reported by the consultant and also discussed was that there certainly wasn't any lack of good intentions around communicating, but that there's been a huge capacity constraint in the Secretariat, and delays in getting some of the most basic communication tools up and running. The key one for that, as has been referred to already, is the website. We don't have a website yet. When you refer to the GFF website, it's really only a landing page, so it's pretty much just a very one-dimensional repository of some documents we've been able to post. But we're hoping, we're not hoping, this is the plan, that by the end of April we will have the first phase of a fully functioning website up. And what we've prioritized is firstly the basic documents about the GFF, which are already on the landing page but obviously will be available on the website, as well as all the governance documents, because as has already been mentioned by Joanne, there's a lot of interest in those documents, what gets discussed at the meetings. And right now the only place we have to share those is on Huddle, which has limited accessibility. And so all of those documents will be on the first phase of the website. And then most importantly, we will have our country pages up. And that will be the repository of all things that are happening at the country level, with obviously a certain bar. You know, things that are still in discussion or haven't quite been finalized will not be posted. But as soon as we have approved investment cases, we'll have updates on what's happening with health financing strategies. We'll have information around what amounts of money have been allocated from the trust fund, from other donors, what co-financing is being anticipated, and any other sort of country level information that we can usefully provide. So I think that will make a huge difference. It's and then you know, we'll move on to a fully fleshed out website over the next couple of months. One of the things that we're hoping to really establish is a kind of a knowledge hub, and we'll be reaching out to all of you for focal points and we'll probably use the PMNCH and the Every Woman, Every Child and UNF communications platforms to do some of this outreach. But we want to make sure that we're able to link to all of your websites, and especially to areas where you might have tools and other kinds of useful information and knowledge that can be shared with our countries. So we don't want to replicate all of that on our site. That's not the purpose. It's more to create a network and to link into the existing networks on many of the issues that we work on. So we'll be reaching out to you about that. We also am hoping that we can do a lot of linking to partner websites as well on advocacy in particular, and on some of the other issues that have been raised around making sure that the SRM NACAH, and we really need a new acronym or a new word for the acronym, that we create momentum around that, and obviously that's what the GFF is intended to do in terms of raising financial commitments and so on. But I think collectively as a community, we're all doing a lot, and I think we would want the GFF to be very much a part of all of those things, link to other activities, share partners, feeds, and other kinds of ways in which we can all connect up on the advocacy front. In terms of our priorities for the communication strategy, obviously the information sharing and the having a website that is a repository for that is really important to us, and linked to that will be a social media strategy. So we'll be able to send you all some media plans, social media plans and so on for the launch, and we hope that everybody will be able to help us get going on that and build an audience for our website and for our social media feeds and so on. And similarly, we'll do the same by linking up with all of you. So that's a big area of effort. But then we're also very focused on, I guess, what Joanne quite articulately described this already, the fact that we will have a kind of a slow build of advocacy over this year, very much building on the support for other replenishments that are happening this year, like the Global Fund, like the IDA replenishment, and that we will be doing sort of partner-friendly advocacy, and try to start telling the story of how the GFF contributes to all of these bigger processes. So we'll be focusing on that as a sort of a slow build over the rest of this year, with the idea that next year will be a big push for fundraising and resource mobilization for GFF and for the model itself, and a sort of more attention being given to explaining the model and showing early successes of the model and things like that. So because of that, one of the things we've been focusing on as well has been making sure that the explanation of what the GFF is and isn't is very clear. So part of that was an exercise around a mission statement, which has now been finalized, and which we will be using as a key communication tool, and we can certainly circulate that. It's been circulated to the investors group, and we can circulate that very widely. It's just the highest top line kind of message in the plainest language we could all agree on, that explains what the GFF does. But then we'll be following that up with a revision of the frequently asked questions, which have been distributed and are currently on the landing page. But we got a lot more questions. Obviously, it's a living document, so there were either, based on the last investors group meeting, there were further elaborations on some of the answers, and then there are new questions that have to be addressed. So we're busy working on that right now, and hoping that that will be one of the key products in the next couple of weeks, and that will be very much the basis for many of the messages and the explanations and so on that will be found on the website, because it ranges from everything from explaining all the financing mechanisms to talking about what countries are involved, the explanation for how we're moving on new countries, what the GFF might be doing in different contexts or for different specific things like CRVS or and things like that. So we're hoping that that will also help bring clarity to some of the areas where there's been confusion. And then the other focus for the communication strategy for this year will be to drill down to some country level stories and really start telling the story about, you know, how things are being, how progress is being made on things like CRVS or domestic resource mobilization or adolescent girls or whatever we find as interesting stories to tell. So we're also going to try and produce more content that will focus very much on specific countries and specific areas in each country. Obviously, the other piece that we'll do, which is again very much linked to partners and to our community, will be to focus on, you know, special days, Youth Day, all the various international days, and we look to all the partners in terms of having mutually supportive strategies around that. We'll certainly do some social media around Women Deliver, but we want in terms of what their messaging is and how we can together advocate for the things we care about. And we'll be focusing on some of the other things. There's the World Health Assembly, there's the World Humanitarian Summit, and then our sort of first anniversary over the summer and into the UN General Assembly session. So we'll be developing messaging for all of those events as they come. And then sort of towards the end of the year, we're hoping to really have some interesting content from our countries and make more of the specific storylines around how things are progressing at the country level. So I think I'll leave it there. I think that there's one sort of formal aspect of the communication strategy that I'll just flag because it also leads into the investors group. But there is, as you're aware, within the Every Woman, Every Child process, the development of the accountability framework and the indicators and measurements and so on. As a subset of that, the GFF is developing its results framework discussed by the investors group in June and hopefully agreed. And so we'll have all the indicators that both financial and programmatic that are going to measure the GFF. And which, as I said, will be part of the reporting for Every Woman, Every Child. So that's an important piece of the puzzle and will form the basis of our annual report for this year, which will obviously be a little different because it's a little early to sort of show results, but we certainly hope to, from next year, have an annual report that concentrates on the delivery of that results framework. Probably this year our annual report will focus more on the evolution of the model, how things are working at the country level, and an explanation of what the monitoring and results framework will look like and how we will report on that on a regular basis going forward. So that's a sort of formal piece of our comms and governance strategy that needs to evolve over the next couple of months. I'll leave it there, happy to answer any questions, but thanks for the opportunity, Kristen. Thank you.
Great, thank you so much, Diane. I think that information was really instructive to all of us. We have gotten a few questions, and I just wanted to invite everyone again to send in any questions that you may have through the chat box. And also, if you are working on GFF at the country level, please, if you have anything to share about your experience, send that also through the chat box, and we will be able to share that with the group. So now to the questions that we've got.
And Christine,
yes.
Petra's on the line.
Sorry, who's that?
Hi, it's Petra. I just wanted to say I've joined.
Okay, Petra, thank you. Welcome. Petra is with the GFF Secretariat at the World Bank. So Petra, please feel free to chime in if you have anything that you want to add while we go forward with the conversation. So now on your screen, you should be able to see the questions that we've received. They are certainly pertinent to the investors group, but also quite wide in terms of engaging with GFF. The first is, do you have any updates to share around the topic of procurement under the GFF? I know there has been a lot of interest, especially in procurement for reproductive health commodities, but this is about procurement in general. The second is, what financial resources are available to civil society actors to get engaged with GFF and to advocate for it? And the third is, my apologies if I missed this in Joanne's comments around the resource mobilization discussion, but were clear next steps identified out of the IG discussion? Have any targets for resource expansion been approved? So I am going to now ask our panelists to join us. Mesfin and Joanne, why don't I start with you, and then we can switch over to Diane and Petra. Joanne and Mesfin, would you like to contribute anything to these questions?
I can start. It's Joanne. So on two of the questions, on the issue of financial resources for civil society, we raised that specifically as a priority, particularly, I mean, it's obviously important at all levels, but we raised it particularly in the context of at country level. So, if, part of what it's going to take for civil society to be meaningfully and ongoingly engaged in the country platforms and in the work of the developing, implementing, overseeing the investment case, it's going to be really important to have a stream of resources, or more than one stream of resources, to make that possible, and that we cannot count on that just being part of the country budget, that the country itself will do that. So we raised that, but there kind of raised it, previously raised it in the Nairobi meeting, but at this point there isn't a specific strategy or commitment on that. But I think it's, for us as civil society and supporters of civil society and country, it's going to be really important to be identifying where that stream of resources would come. Can some of that come through globally through the GFF, and what additional kind of resources can we find? So it doesn't exist yet, but I think it's really, if we're talking about financial resources, that's really important. I would say also there's really good work that was pointed out that's happening. I think, Kadi, you mentioned it, among a number of partners. There are other resources that specifically to support civil society in engagement and also in accountability. So there are some of those other kind of tools and resources being developed, but we're also going to need financial resources, so people aren't expected to do this, on the side of their desks or after their more than full-time roles that they're already playing. In terms of the next steps, I'm actually looking at the notes, but in terms of the next steps out of resource mobilization, as I said, I think there was there is a plan to look at replenishment of the trust fund, like, renewing resources and finding new resources for the trust fund ongoingly, but with a focus on that in 2017. So my assumption, and ideally, would be to have a strategy developed between now and then for that piece. But there was, also just the issue raised that with all of the other work that's going on, unless we can be more aggressive in resource mobilization, we'll miss the opportunities that the GFF offers. So there was an agreement also to look more closely at and get a report back to the investors group around sources for domestic resource mobilization. And, I would say that there are discussions going on and work among various partners about potentially identifying new donors for the GFF, but there wasn't, I think, a specific set of either a specific target or explicit commitments that came out of this investors group meeting. I don't know, Dan or Petra, if you would add to that.
Yeah, maybe just to add a few points, Joanne. I think the investors group certainly discussed this issue very extensively, and there are quite many mechanisms that has been explored. I think Joanne has already mentioned, some of them, and which include actually new mechanism for raising new resources for RMNCH. And I think there was a specific reference to the Addis tax initiative and then tax reform for increasing domestic resource for RMNCH. I think those resource mobilization, to use these new resources for financing has been one of the recommendations, and how that's going to use and help to bring new resources, that's yet to be seen. But I think those are some of the issues that was recommended by the IG to be included in the paper. And of course, gaining efficiency, through from the existing investment, as well as, of course, market shaping. I think some of the point that would bring new resource. There was a reference to the Global Fund resource or investment in RMNCH in their new strategy framework. I think that was mentioned by the Global Fund, both on health system strengthening, and I think the recommendation is to create better linkage, to use those opportunities for improving or access to service for RMNCH. And of course, the investor group as well requested further analysis in terms of domestic resource, where that new money is going to come from, again related to taxation, and whether new resource from extractive resource or other source of money that could be leveraged. I think there are quite a number of suggestions put forward, including, of course, the IDA replenishment and how to increase trust fund envelope. Those are the the mechanism that has been explored, and the task team that has drafted the resource mobilization strategy has been asked to reflect on some of these issues to bring back to the next investors meeting. That's my understanding and recommendation that came from the investors group. But the first question on the procurement, there wasn't such specific discussion around procurement, but I think this is one thing that was mentioned even in the Kenya learning event in terms of reproductive health supplies specifically. And I think it is the country investment case, how they see and prioritize those, and access to commodities. I think it's a key area. It's also a key aspect for supporting RMNCH. But there wasn't such specific recommendation how the GFF is going to approach this. I think, as far as my knowledge is concerned, I think we have not been, going to that level of discussion on this particular issue. So I'll probably let Diana or Petra, maybe if you have some thought on this.
Great, thank you, Joanne and Mesfin. Can we go over to Diane and Petra for anything that you'd like to add from the bank? You are both unmuted now.
Thanks. So maybe I'll start just on the certainly on the resource mobilization discussion. I think both Joanne and Mesfin have described it well. I think we have to remember that this is a very complex, multifaceted strategy, and so what we discussed was very much the outlines for a very broad framework, which includes some of the innovations under the private sector, which we hope will start generating actual money, as well as some of the other reforms and innovations. And so what the Investors Group has asked for, as Mesfin has indicated, is some further discussions on some of those elements, like the tax piece and domestic resource mobilization. So the Investors Group will be following up on those and looking at some of those questions. They've also asked for both a short-term and a long-term resource mobilization strategy. So we'll be looking at a strategy that, as I've outlined, is opportunistic and supportive of partners for this year, so that we, I think there's no added value in us all cannibalizing each other's financing over the next year. There's going to be a big pressure on ODA, and I think we're going to have to be very strategic in how we advocate for increases across the board to development and to health. Having said that, we do have some ideas of short-term targets, but obviously those are sensitive in some ways, and we're hoping to make progress this year. But the big push will be next year and in the ensuing years. We have a request from the IG to do a much longer-term strategy that looks over the next sort of couple of cycles of various organizations, replenishments, and how that works. Given that the goals of the SDGs are till 2030, we need to take a very long-term view about how the gap is going to be filled. I think also there's a similar approach on some of the procurement issues. The IG has also asked that we look into some of those, so that will be on the agenda for future investment groups, where we'll look more at market shaping and issues of supply chain and so on. But as indicated, we're also trying to do that in partnership with the Global Fund and Gavi, who have already done quite a bit on that. So we want to fit into the landscape and see where there are gaps and where we can usefully contribute, rather than reinventing the wheel when it comes to the great progress that's already been made by other organizations around that. So I think I'll leave it there. I think that pretty much answers all the questions, and I think, Joanne, you've already discussed the issue around financial resources for CSOs. I know that is an ongoing question, but it hasn't been explicitly addressed at an investors group to date, although there is recognition that that additional support needs to be given for full participation of CSOs at the country level. I think a lot of discussion, and Petra can perhaps talk to this, I know we're going to give a full country update in a little while. There's been a lot of discussion of engagement of CSOs for implementation at the country level, and a great recognition that that's essential. But there are no hard and fast rules yet about how that's going to work, given that each country has taken a slightly different approach. I'll leave it there. Thank you.
Yeah, and this is Petra. Maybe if I can just compliment Diane and Joanne and Mesfin, that also I think, and this I felt was a very strong signal from the investors group as well, that what is really very clear is that the procurement and all other aspects when it comes to the investment case are very much, there's a very much emphasis on country-owned decision-making. So at this point in time, apart from what I think other colleagues have also highlighted, the importance of looking, are there gaps and so on, are there issues, I think every country is requested to look at these aspects of procurement and ensuring in their investment case this is brought up. I think a lot of countries, family planning is one of the core ones, and it's a big one that countries discuss. When I'm looking at, for example, in Kenya, there's a discussion about that. There's also a discussion about that in several of the other countries, specifically on family planning commodities, to make sure that they will be available. But of course, the needs are vast in all areas, so it is always part of a prioritization process. So that's just what I wanted to add.
Great, thank you very much. I have two quick questions, I think probably most appropriately directed to Diane and Petra, which are follow-up to what we've been hearing. The first is, where and when will the IG meeting report be made available? And the second is, we've mentioned the private sector engagement strategy paper, and where can that be found? Is that available publicly? Thank you.
Diane, you're probably best.
Sorry, Christine, Yeah, sorry, Christine, I just missed which strategy paper was the second question?
It was the private sector engagement. paper?
So firstly, the IG meeting report has been circulated to IG members and is available for circulation. We're, as I mentioned, the only place we have to share all the documentation is on Huddle for the moment. But the report is free to be circulated, so I can certainly, and Joanne and Mesfin have it, so they can certainly send it out as well. We're, as I've mentioned, we're focusing all our energy on getting this website up, and all of those documents will be available then in line with the policies we're developing, as Joanne explained, in relation to the transparency of documents after meetings and so on. So the IG has asked us to take a very transparent approach. So as soon as things have been considered by the IG, they can be shared. The caveat is obviously where documents have not been agreed by the IG and where they've asked us to go back and do additional work, and the private sector paper falls into that category. So the investors group had asked us to revise that paper and circulate it for no objection approval by the end of this month. I'm hoping to get it out a little ahead of that for approval with all the additions that Joanne and Mesfin outlined that need to be included in that paper around equity and other issues that the investors group had asked us to elaborate on a little more. So that's actually the only paper that is being revised before adoption. That is prepared and will certainly be up on the website by the end of April. And I can make the meeting report available. Christine, if you want to circulate it to this group as well, that's fine. Thank you.
Yes, thank you, Diane. Yeah, that would be great, because any documents that we've talked about today, we can circulate to those who have participated on the call. So please, everyone know that you will be receiving them as a follow-up email. We've got another question, and again, I'm just going to read it because this relates directly to what we've just been discussing. What are the links between GFF resource mobilization and and Global Fund replenishment, if any? What are the concrete recommendations that came out of the IG on alignment between the Global Fund, Gavi, and the GFF? Petra and Diane, I think you were already speaking to this a little bit. Perhaps if you could just say a few more words. After that, we're going to go to Kadi and Mati to get a quick update around country level progress. So Diane and Petra, over to you.
I can talk a little bit about alignment about Global Fund and Gavi, which I think I was asked to also speak a little bit about what's happening in the different countries, so I can maybe address it there, so it's a bit more specific rather than very general. And maybe Diane, do you want to talk about how the resource mobilization for the GFF and Global Fund and so on, replenishment, how this was discussed at Investors Group?
Yes, please go ahead. You both should be unmuted. Hold on.
Sorry, I was talking, but I don't think anyone could hear me. Can you hear me now?
Yes, we can hear you now. Thank you.
Okay, so the Mesfin already made reference to the fact that the Global Fund is in their new strategic plan making sure that they are doing more on RMNCAH and certainly connecting more to women's health as part of their strategy and as part of the way in which they're going to sort of adapt their implementation. So I think we're trying very hard to be mutually supportive. I think the best way to illustrate that will be when Petra explains some of the country examples. But we're at the global level very actively engaged with both Global Fund and Gavi to make sure that we align implementation at the country level as in ways that are as mutually supportive as possible and where we're creating synergy rather than overlap. And so what we're hoping is that those examples will flourish, and we'll be able to tell a really good story for both of our purposes. You know, the Global Fund is under pressure certainly to show that it isn't a completely vertical program and that it is contributing to health system strengthening and other things. So it certainly serves their purposes in terms of their replenishment to be able to show that alignment at the country level, and similarly with Gavi. So we're hoping to, in showing how we are in very practical ways making that work at the country level, we're hoping to be able to be very mutually supportive in our fundraising efforts. I think there is a piece of work, and we've had some discussions about this, but there is a piece of work to be done around a broader value proposition of the whole health sector, right? In the new SDG environment, all of the very complex and multifaceted health architecture is going to be under scrutiny, because we're going to have to be super efficient to show that this is worth the kind of investment that we've enjoyed over the last 15, 20 years, and show that going forward this continues to be a worthwhile investment. And we know that there's pressure on climate change and then security issues and migration, refugee crises. There's a lot of pressure on ODA budgets. So part of the solution is, of course, that we have to look beyond ODA and look for other ways in which we can access new financing. But also within the ODA environment, showing how every dollar is used super efficiently and without cannibalizing other revenue streams, and where we can really show additionality. And I'm sure many of you, like me, have been around having that additionality discussion for decades, and we really have to get to the point where we can clearly show that everything is being used efficiently, and that we're not substituting for other channels of funding and so on. So I think that's a mutual challenge that we're all committed to working on in terms of developing good value propositions, and I think that'll be certainly part of the GFF strategy, will be to figure out a partnership strategy for resource mobilization that is, as I've said already, not challenging and competing with those other organizations, but actually reinforcing and a sort of positive additional discussion and conversation with potential donors. So I'll leave it there. I think it'll be much more obvious when Petra does the country update how that might work.
Petra, please go ahead.
Okay, do you want me to talk a little bit about the progress in countries?
Yes, that would be great.
This.
And then perhaps when you finish with that, we can go to Kadi and Matti to complete this section.
Great. Okay, so as you know, the GFF portfolio exists of 4 frontrunners: DRC, Ethiopia, Kenya, and Tanzania. And then there's been a second wave of countries: Bangladesh, Cameroon, India, Liberia, Mozambique, Nigeria, Senegal, and Uganda. And I'll touch base on them briefly, some of them a little bit more in depth than others, mostly also linked with their status. So Tanzania and Kenya are really pioneers, and some, like DRC and Ethiopia, are really focusing for the national strategy. I think, Diane, we can hear you type, so maybe you can mute yourself. And then in 2016, we have some quick starters that are part of the second wave countries, particularly Cameroon, Liberia, and Uganda. And they are currently in the process, really, of developing the investment case and all the processes. Early in 2016, we're really expecting a lot more to happen. So now in Bangladesh, Mozambique, and Senegal, while India and Nigeria are still determining their approach. So there are different phases in different countries. So I'll talk a little bit more about the ones that are a bit more advanced. So in Cameroon, there is a a country platform that consists of the Health Sector Strategy Steering Committee, which is supported by 2 technical working groups. And multiple partners support different elements of the process. There is a really strong collaboration between partners, particularly among UNFPA, UNICEF, Gavi, and the Global Fund. And of course, the bank is part of that as well. In February, there was a prioritization workshop on the investment case, which really increased the inclusiveness and the political buy-in. There were about 100 people that attended the opening and more than 60 people that stayed for the 2 days working meeting. And the focus really was on establishing geographic priorities and beginning to select really key programmatic areas. The investment case is supposed to be finalized by the end of April, and the major emphasis is now on gathering data for decision making, and discussions on complementary financing are now underway, including with France, Germany, Gavi, Global Fund, and the US government, particularly PEPFAR. For the health financing strategy, Cameroon has very limited material to draw on. There is no existing strategy. So they've just started with a kickoff workshop in February, where they agreed about the analytical work that will be used to form the basis of the health financing strategy. And it's expected to be finalized by June 2017. For DRC, the country platform builds on the existing multi-partner platform, and they have made some progress on finalizing the investment case. There's a specific World Bank project that's supporting the investment case, and that focuses on strengthening the information system with a total of $30 million in IDA and $10 million from the GFF Trust Fund. And it will also be a particular focus on CRVS with $10 million in IDA and $10 million from the Trust Fund. There are bilateral linkages planned with the Norwegian Climate Change Initiative as well, and that's particularly focusing on the financing of the investment case. The health financing assessment has completed, and that will inform the development of the health financing strategy. So there are some drafts of part of the elements are prepared, but some areas, like quite important areas like pooling and purchasing, are still under development, and the finalization for this is expected in June 2016. In Ethiopia, there was a GFF announcement proposed for 15th of March at the Joint Consultative Forum with participation from the Ministry of Finance and other partners as part of the country platform. Following the announcement, there will be, or there is planned to be a mission in the week of April 11, which is being confirmed, to shape the investment case from the health sector transformation plan, because the government really, as I alluded to in the beginning, first focused on their national strategy, the health sector transformation plan, and then are shaping the investment case out of that. The health sector transformation plan includes a strong RMNCAH component, which will therefore form the basis of the investment case. The goal is to complete the process by September. There may be $75 million in IDA available this year to actually also help support the investment case. Health financing strategy, there has been a draft that's currently under review. Health financing, we know, is a key issue. Both the social health insurance for the formal sector and the community health insurance for the non-formal sector are really important aspects for Ethiopia that are being explored. Kenya uses the RMNCAH technical working group for the investment case and the health financing technical working group for the health financing strategy. So that sort of composes the country platform. The investment case, there was a national RMNCAH investment framework approved in country, and country plans have not yet been, county plans have not yet been developed because of the devolved setting. At national level, there is a framework that has been developed, and now counties, individual counties, are developing implementation plans that will sort of, be like county-specific plans. There's a multi-donor trust fund for technical assistance that is being established. It's set up locally with funding from the bank, USAID, and DFID. And JICA is also working with different partners to to do a training to strengthen the county planning processes for these county plans that we just mentioned. There is a World Bank project that is awaiting board approval probably around June 2016. And there is a mission from the bank planned at the end of this month to work out the financial flows in country, because of the devolution situation is very different. So working out how that will work in country requires some in-depth discussions. The health financing strategy has been a long-standing process, and it has currently, the draft has identified 5 key areas: resource mobilization, purchasing, benefits definition, accreditation and licensing, and governance. For Liberia, really, it's nice to see that the country platform is galvanizing country ownership. They're strengthening their coordination through country engagement in the IHP Plus process. So the country is planning to sign up to the IHP Plus, and these elements will build on, or will be used or strengthened, and then also be strengthened for design and implementation of the investment case, as well as the health financing strategy. There's an updated costed investment case that has been shared for consultation. There are 4 priority areas that have been identified: quality, emergency, obstetric and neonatal care, as well as adolescent and youth-friendly RMNCAH service delivery. Emergency preparedness, surveillance and response, especially maternal and newborn death surveillance and response. Sustainable community engagement, and an enabling environment, leadership, governance and management at all levels. A lot of the priorities in Liberia build also on the lessons learned from the Ebola epidemic, and really looking at like the community engagement and emergency preparedness, surveillance and response, as well as of course the important area of adolescent health. There's a tentative joint mission with Gavi, Global Fund and the bank in April, which will focus on joint M&E alignment of financing of the investment case and emphasizing adolescent health. And the tentative board date for the bank project is the 20th of June. Global Fund has a health system strengthening application process that is currently in process, and Gavi has a request due in September. So this is where the different financiers are really clearly trying to align and discuss together to make sure that these different financing available will support the investment case and is aligned properly. There is an existing health financing strategy that's being updated, and that will be complemented by a concrete implementation plan with prioritized action. And the key areas in that have been identified are health equity fund and improved alignment, and on budget donor funding. Mozambique is more in the early stages. They will use their existing coordination platform in the health sector, which I understand has a wide civil society engagement already. The MOH has established a task force that's led by the National Director of Public Health, who will lead the GFF process. There's quite some emphasis on the private sector mobilization, and there is potential involvement of Ms. Graça Machel and First Lady Isaura Niusi to further mobilize stakeholders. The investment case and the health financing strategy are both in their early stages of development. At the end of March, they're planning to do situation analysis to identify bottlenecks and prioritize high impact interventions, and also look at the resource mapping. And by the end of April, there will be a mission to support prioritization and resource mapping processes. Tanzania, the country platform uses the SWOT coordination mechanism, and that is supported by technical subgroups focusing on RMNCAH and health financing, which had quite some wide stakeholder engagement at the initial phases. One Plan 2 is used as the investment case, and implementation began in 2015. There are ongoing CRVS-focused discussions with RITA, WHO, UNICEF, and other partners. The health financing strategy has almost been finalized, there have been some delays because of transition to a new government, and it requires parliamentary approval. For Uganda, they also use the existing health sector coordination mechanism. The sharpened RMNCAH plan is still being revised, and they're including to add costing scenarios to address the financing gaps. There are broad agreements on the packages to be prioritized, which include skilled birth attendance, family planning, post-abortion care, and delivery over the RMNCAH community package. There is also agreement on the importance of prioritization, particularly geographic prioritizations, but there are still questions on how that will take shape. There's a mission this week that is actually looking at supporting further development of the investment case. The health financing strategy is revised. There is a prepared draft, but it has been held up because of the elections. Bangladesh, I'm almost at the end. There's so many countries. The GFF launched at the end of January, and the event included the government and other partners. There is a 15-year history of SWAP, and there's strong active engagement of civil society in the private sector. The investment case, additional financing is being discussed for the end of this year or June 2017. That means World Bank additional financing. And the country is finishing its current sector program, and a new sector investment plan is under development. So this will be operationalized through a program implementation plan that provides opportunities for defining the RMNCAH investment case. So the GFF will be linked to the next sector program that will be results focused. And JICA is continuing to contribute to financing the sector program as well. The health financing strategy has been there since 2012, and analytical work on fiscal space, PER, public expenditure review, and national health accounts is currently underway. India is still determining its involvement with the GFF, and we're expecting decisions by the end of March. At Nigeria, they're discussing, also because of the large country, whether to focus at the national level or at the state level. So currently discussions are on the way of how the focus will be most appropriate, and that's currently being determined. And the end of March, there is a mission that focuses on the development of the health financing strategy. Senegal is still very early in its stages of development, so not much to report there as of yet. So I will stop there. I hope I didn't bore you.
You certainly didn't bore us. I think that that was information that all of us have been really hoping to hear. So thank you very much, Petra. I'm going to ask Kadi Toure and Mati Jah to come on now and to add anything that they would like to add in addition to what Petra has just been telling us. Kadi and Mati are with PMNCH. So over to you. I'm just trying to make sure that you are, let's see. Mati, you are unmuted, and Kadi, I think you should be too.
Yes. Thanks, Christine. I will probably just defer to Mati to see if she has anything to add to what I said earlier on. Thanks, Petra. That was an extremely useful update and useful for us to know where the countries stand in the processes. As mentioned earlier, we are trying to support a number of constituencies in strengthening their engagement with the RMNCAH platform that the GFF is building its processes off of. And that includes the development of toolkit/guidance notes, which we hope to have available relatively soon, and then support for discussions and consultations in countries that try to define what a process for engagement looks like. We started with the civil society groups, and there have been discussions in Senegal and Cameroon, as mentioned. We will provide to Christine the actual specific link to all of the GFF resources, because they will have reports back from what was discussed in those two countries, including meeting reports and all the documents that went into that, so that people can use those as resources in the development of their own discussions, or just to inform themselves about what came out of those two countries. So with that, I might just turn over to Mati if she might have dates for additional discussions in some of the other GFF countries, and hopefully we'll be able to share these resources online. Mati, are you there?
Hello?
Sorry, Mati, we
Hello?
muted all by accident. You're on now. Thank you.
Hello?
We can hear you.
Oh, great. Thank you.
Yeah.
Thank you, Kathy and Petra. On the dates, I have been speaking with some of the partners in Uganda, DRC, and Mozambique about holding some consultations to try to get CSOs up to speed, share information, and just trying to help them get engaged in the GFF process at country level. What we're trying to do in Uganda is hold a consultation between the 6th and 9th of April. The date should be confirmed between today and tomorrow. And I will share this information as soon as possible with the group. In DRC, we were trying to have a meeting with our partner there. This meeting will be a meeting based in Kinshasa because of the size of the country. We cannot have every region attend, and then the meeting would, of course, have a report which will be shared with all countries, all partners at the country level. We are trying to have this, if not at the last week of April, it would be the first week of May. In Mozambique, we are still in early discussions. The different partners are trying to organize themselves and try to set a date. Hopefully this meeting is also going to happen sometimes in April. As for Senegal, we have held several meetings since the first civil society meeting, which was held early in February. And these meetings are just for civil society to try to get organized and see how they can get involved in the process, in the GFF process. We're very early, even at the ministry level, we've had several meetings and the minister was also involved. I'm sorry, not the minister, some members of the ministry were involved, and they're still not decided on the date. So there's not much happening in Senegal besides just several meetings with larger and larger groups of civil society platforms getting together and trying to get organized and defining their specific roles in this investment case. This is all I can say for now for the country updates. If there are any things that I have forgotten, maybe they can complete. Thank you. Over.
Great, thank you, Mati. I think the last thing that we will note about the country updates is that there was a recent report done by Global Health Visions. It was commissioned by Results, and it looked at civil society engagement in the GFF at the country level. And that report is available. We can send the link in the follow-up email that goes out to participants on this call. In case you haven't already seen it. But we are also in the process of trying to schedule a webinar where we will be able to look at the results of that report in more detail and focus on what is happening at the country level. So more information about that webinar will be upcoming. So I think that we have, oh, sorry, yes. I misspoke. The report on CSO engagement was done by Global Health Visions and by Catalysts for Change. It was a joint production, and so I needed to note that it was both of them. With that, I think that we have covered the agenda that we had laid out for today. I will go to our presenters, to our panelists, just to ask them to give some final words on anything that they would like to emphasize or that they may have felt didn't get enough attention during this webinar. This webinar has been recorded, and the recording will be available on the GHC website. We will not have minutes from the webinar itself circulating, but we will ensure that all of the links of documents and reports that have been mentioned today are included in the follow-up email that goes out to participants. The final upcoming event that I'd also like to note is that we are also trying to put together a Francophone webinar on the GFF that will include civil society and World Bank and Secretariat representatives that will be conducted in French. So we are just finalizing the date for that, and we'll get an announcement out very soon. So with that, let me go to Mesfin and then Joanne and ask for your final comments, and then Petra and Diane for your final comments. Mesfin and Joanne, over to you.
Hello, Christine. Sorry, I was trying to unmute. I think I was muted. Thanks very much, Christine, for hosting this webinar. And I believe it's been helpful for people who have joined us. And I was looking at the number. I think at one point it was around 50 something. So that shows a number of people who continue to support the GFF. So thanks very much once again. We will certainly share the meeting report. I think now it's unofficial, so it can be shared. I just want to say one thing, as we close this meeting. Certainly the IG meeting was very helpful in terms of clarifying the direction on different topics that the IG or the GFF need to work on. But most of the things are happening at the country level, and the GFF continue to emphasize that this is a it's a country-led multi-partnership process. So I think those of you who have joined today, who are working at the country level, I think we need to take this and perhaps use this one for stronger advocacy and inclusion at the country level, just to make sure that actually what is being discussed as a global level is also reflected and acted upon at the country level. So it's a two-way street, and in our role, we'll continue to advocate for stronger civil society engagement, including all the concern that has been raised. And we will feed back to the country guidance document to ensure that key priorities are addressed. But at the same time, let's use this also document to advocate at the country level to ensure that actually these are translated into concrete action. So we look forward to hearing from the country so that our engagement is also supportive of each other. So thanks very much once again, and we look forward to the next meeting, perhaps for the Francophone update. Thank you.
This is Joanne. I think Mesfin said it. I really don't have much to add. I just think, again, thanks to Global Health Council and PMNCH for supporting this, and again, lesson learned that the importance of having had the ongoing support from partners at a global and regional level for country partners, but also, as Mesfin said, and as we said earlier, even as we get country guidance, so much will depend also on the support for country partners to be able to have that guidance and be able to use it to kind of help secure their place at the table appropriately around the GFF country platform, and we'll continue to work to pursue how to find the resources needed, especially for partners at country level. And I think the other points that were raised around, as we've all said before, we want smart financing, and we also need, which points to how do we support countries to have the best investment case, but we also know we need additional financing both domestically and from external sources. So continuing to make sure that that strategy is developed and that it's aligned, continues to be aligned with the work of other international mechanisms and partners that will actually have more money in this space with us.
and
Great, thanks. Well, if I can just pick up there from Joanne.
I was going to go. Go ahead, Diane.
Sorry?
It's Petra. I was going to go, but you go.
I think. Okay, sorry, I'll be brief. I just wanted to say, again, thanks for the opportunity, and also just to flag that, you know, we're hoping to be a lot noisier over the next couple of months, where we have our website up and running and our social media strategy going, and we really rely on and hope for your support in publicizing that. And as Joanne has pointed out, our advocacy strategy going forward, particularly focused on raising resources from all of the various mechanisms, is going to be really important. So we look forward to having that conversation with you all, and figuring out how we can all be mutually supportive to make sure that our priorities do get funded. So thanks, and I look forward to future opportunities. Sorry, Pedro.
That's okay. Thanks, Diane, and thanks, Christine, for organizing this and for everyone to be attending. I see the number of attendees dropping, so I'm going to be very, very fast because we're over time, I imagine. One thing I was really happy to hear, and I think is really, really critical for this group, and you may have discussed before I was online, is what was also mentioned about looking at organizing partners at the country level, because I think it's proven quite difficult to have all, you know, like in Cameroon, to have 100 civil society representatives to have a real meaningful conversation about priorities is, of course, difficult. So it's really important. I think those are important steps that are being taken to look at, you know, how at country level, because as Mesfin highlights, everything is happening at the country level. So ensuring that at the country level, civil society organizations also coordinate together to come with one voice and be, you know, contributing to the discussion as well as supporting the implementation is, I think, really, really critical. And I think the other thing that is really, really critical, we know that we haven't worked out how to do this well. I mean, the countries I listed, some of them, civil society cooperation is going well, and some it's not going as well as we would like it to be. But I think the GFF very eagerly decided to do a learning by doing approach rather than waiting to have worked everything out. So I think we'll learn different things from different countries, and I hope that all of you will help and will be supportive of this learning approach and try and constructively make sure that we continuously improve how we engage the civil society, because it's really critical to have all of you involved in the design, the implementation, and the monitoring and evaluation of investment cases, financing strategies, CRVS, all the aspects, the health financing alignment that the GFF envisions. So thanks again for organizing this important event where this can be discussed.
Great. So with that, I'm going to thank everyone. We will be sending a follow-up email out to the participants on this call that will contain links to the documents that have been discussed today. We will continue to hold these briefing and debriefing webinars for the community on a regular basis. And as I mentioned earlier, we will have 2 upcoming webinars that are in the process of being organized. One on country level civil society engagement, and one in French on the GFF, but specifically for our Francophone colleagues who would like to participate in that one. So with that, I wish everybody a good rest of their day, and we look forward to continuing the conversation. Thank you very much. Bye-bye.